Morning, good afternoon. I'll start again. Good morning, good afternoon, good evening, depending on where you are situated. It is my distinct pleasure to be the moderator of today's Interprofessional Global Café. My name is Dr. Kateryna Metersky, and I'm an assistant professor as well as an associate director of the Collaborative Nursing Degree Program at Toronto Metropolitan University. But today I wear also the hat of being a representative of the Canadian Interprofessional Health Collaborative with the International Global. It is my distinct pleasure to welcome you into the space on a topic that's dear to my heart called Exploring the Lead in Health Professional Student-Led Experiences, a scoping review. We have a number of phenomenal speakers for you today. From the University of Toronto and close to my home are Dean Lising and Kathryn Parker. And then we also have three speakers from the University of Queensland, Jodey Copley, Teresa Quinlan, and Anne Hill. At this point, I will turn it over to the presenters to get their presentation started, and then I'll navigate the rest of the sessions once their presentation is completed. Over to you. Thank you.
Thank you, Kateryna. Can everyone hear me okay? Thumbs up. Great. So welcome, everyone. Welcome to the Global Cafe. We hope you have your coffee. So I have mine right here. So, and for those of you who are in many different time zones, you might be having an afternoon coffee, siesta. It could be your morning wake up, or it could be evening for some of you. So I really appreciate it. I'm looking through the audience. This is really international. Recognize a lot of names. So this is going to be a very open, interactive discussion. We'll have a pause point in the beginning, in the middle, and then we'll have a good amount of time for questions. So we've intentionally built in a lot of time to hear from you as well. So we really want this to be a true global cafe. Thank you, Interprofessional Global Cafe, for the opportunity. We're going to talk about our exploring the lead in health professional student-led experience. So this is a recently published scoping review that we collaborated across Canada and Australia, and we'll tell you more about our backgrounds. And we really look forward to comments, question, feedback, and we really want to take a global perspective because we do know that we are capturing two parts of the world in terms of perspective. And I really had a chance at the AMI conference, which is in Barcelona, to hear from different parts of the world, some that are captured in the scoping review and some that we learned that are new. So this is the actual scoping review citation. I think I put it in the chat. Oh, I didn't hit enter. There it is right there. So if you do want to look at it as we go, it is open access, and you can use a QR code as well to scan your phone. And really want to be reflexive about, we tried to be that way in our scoping review. We want to be openly reflexive that we do bring perspectives. I did mention we do bring a specific perspective from Canada. So we're at the Center for Advancing Collaborative Healthcare and Education, or we're going to call it CASH sometimes. We love our acronyms in Canada. And so myself, and you're going to hear from Kathryn as well, come from CASH. And so that is a center of interprofessional education and care and research that collaborates across, you'll see two logos there, University of Toronto and University Health Network, which is our hospital and health network. Also representative, we'll tell you more about this, but Julia is our academic librarian from University of Toronto. And we also have University of Queensland here. We represent faculty, we represent student-led curriculum, IPE curriculum developers, we represent student-led clinic managers. We also are interprofessional. We are PT, OTs, educators, and faculties. And since we have time, maybe I'm going to draw out and you can just say a quick hello. So again, I'm Dean Lising, and I'm the physiotherapist, and I'm also integration lead at CASH. But maybe Kath, do you want to say a quick hello?
Sure. Good morning, good afternoon, good evening, everybody. It's lovely to be here. And so my name's Kathryn Parker, and I'm the Associate Director of Transformative Change and Evaluation at CASH, as Dean has mentioned. as well as a member of the board at the Canadian Interprofessional Health Collaborative. So it is lovely to be here. And I will pass it over to our colleague and friend, Jodey.
Hi, everybody. Good evening from Brisbane, Australia. It's just past 9 p.m. here. So we're probably past our coffee for the day. And myself and 3 other members of the team, and Teresa and Freya, we're all from the University of Queensland. I'm the head of occupational therapy at the university, and we have 2 other occupational therapists and Anne, a speech pathologist. And we have between us experience in interprofessional curriculum and a long history of experience in student-led university clinics, which is where our interest in this area originates from. So thank you all for having us.
And Anne and Teresa, not to put you on the spot, but we do have more time today than we expected. So Anne, do you want to say hello? And Teresa, no pressure to say hello as well.
Hello, everybody. Good evening from Brisbane as well. So lovely to be here for this presentation. As Jodey said, I'm a speech pathologist and an honorary associate professor in speech pathology at the University of Queensland, and have been delighted to be associated with our University of Toronto colleagues for quite a long time now, around many years, and it's lovely to have this collaboration that's ongoing and has led to us presenting here today. So thanks all for coming to me.
And hello, good afternoon and morning and evening. My screen seems to be frozen, but my name is Teresa Quinlan. I'm a clinic manager for our student-led occupational therapy clinics, and also working with interprofessional clinics in speech and occupation and speech, occupational therapy, and physiotherapy. And yeah, really excited to be here, and our long partnership with University of Toronto and being part of this research has just been eye-opening and resonated. I'm in the clinic every day and I work with students and experience this. So I'm passionate and really interested in the research we've been doing, and excited to hear from all of you this afternoon.
Thank you so much. And you can see, thank you, Kateryna and Allison and others who are dropping our some of our bio information. And actually, interesting, I forgot to add, I'm actually a student myself. I'm doing my PhD at the Wilson Center at University of Toronto and University Health Network. So you can see our vested interest. We're really excited. We are integrated in this work, but because of that, we are reflexive that we do have our biases and perspectives as we kind of move forward. Now, I did mention we presented this recently at AMI Barcelona. So we well, I'm particularly myself, ate well there, but we all have a fan of Spanish food. So we thought we'd have a little bit of a food theme. So if you do get hungry, depending on your day, you might feel up for some of the, whether it be tapas, which is kind of like our introduction. Primer plato is the first course. We'll be talking about our research question and methodology. We'll pause if you have any questions about our methodology at that point. Segundo plato is like our second course. Jodey is going to talk about the results and the discussion. And then the postre is like the dessert. So that will be some of the reason we really are excited about this is every place we've taken this, we have gotten comments, questions, engagement, and we want to continue evolving this work. So we have a global invitation to do that at the end of our presentation, and we would really love your engagement. Okay, so on to the meat of the presentation. Forgive me, I'll have a lot of food puns if I can. And as you can see, I do have one right away. It's just food for thought. And these are the points we would like to take away. We are presenting a lot of information, but if you can walk away with these 4 thoughts, that leadership is not just a word. Leadership should be intentional. Leadership can be a balance of autonomy and facilitation. And can we aim for transformational and collaborative leadership? Now, we are reporting in the scoping review, but what we try to do in the scoping review is actually making sure that what are we going to do with this information? So we actually consider these actually 4 key provocations. We are challenging some of the what we think we can do with this information. And so those are kind of our positions that you will see in the discussion, but we really want to make explicit. And now let's support some of these positions that we are discussing. And so as we get onto our tapas, we're gonna hopefully get your appetite wet and just give you something to chew on. And we actually, I think all of the people here, I looked through the audience, you come from amazing perspectives where we know your work is linked to healthcare transformation, healthcare collaboration. So our problem is a complex world. We have the status quo is not just preparing our students to be clinicians, but we need them to be bold and innovative leaders. We are asking them to transform the system, and who better to be creative, energetic, use the most cutting edge technology and evidence than our student leaders. But when we do that, how do we know we're actually developing them? How do we know we are advancing leadership competencies? What type of leader are we developing? And so what you can see is we are from the literature, by creating student-run, student-managed opportunities, we had a wonder if we were actually empowering our students. And we also ask ourselves, are we exploiting our students? If we're not developing student leaders, are we just providing student labor? And I know this, I know because of Amy, this stirred up a lot of discussion. And so I told you we were going to be provocative and give you something to chew on. But we will circle back to the discussion because we do see kind of all sides of the value of empowerment, but also the risk of just focusing on the service and the labor. I also check in. Are there other words you think of when you think of student leadership? Let's just look at the chat. Again, we have a little bit more time. So are there other words that you may think about when you think about student or leadership in general? Just go ahead and pop any word that resonates with you when you think about student leadership. So we'll get you warmed up as well. We'll give you a little bit of tapas. Just any word, if you can post in the chat. What do you think about when you think about leadership and students? Emerging. Thanks, Kateryna. Anyone else? Tentative. Love that, Chris. Energetic, passionate, open. Sometimes mixed results. Oversight, Susie, we're going to dive all over. Should we have oversight of student leadership? Influence. Influencing. Accountable. Lovely. Thank you, Sakina. Communication, yep. Thank you, Camilla. Brian's mentioning, let them almost make mistakes. Be there as backup and help them learn. We're going to talk about autonomy and risk, shifting between student-led and student-informed. Interestingly, we actually did see that in the literature. Student informed, student guided. So some things that weren't so much as led and transformative. Thank you, everybody. That was hopefully had a little bit of a warm up there. And this is what we saw. We saw all sorts of variation here. The one thing we did notice as we were looking at other reviews, and we'll talk more about what we mean by you can see the acronym from the beginning. Student-led experiences was SLEs, but we're going to help define that. But what we did see when we started to look at student and interprofessional leadership in reviews that focused on this idea of student-led experiences, there were operational models of clinics, of interprofessional training wards were very common. They were very much descriptive and educational reports. It's like structural models that described medical student-run clinics or interprofessional education training wards. Service learning, where we saw students filling a service gap. And so what we we're really interested in is there was quite a bit of variability in terms of the pedagogy, the methods, integration of student leadership. I've mentioned some more implicit, some more explicit. All of us are here with our interest in interprofessional education and practice and globally. Very interesting to see a gap in interprofessional and collaborative leadership definitions, theories, and concepts. There were interprofessional competencies that we'll talk about more, but in terms of leadership, it wasn't always called out to be interprofessional or collaborative. And like you just did, I love that chat. Lots of terminology: student infused, student led, student run, with various levels of initiation, integration, and operation. So the focus was not as much around the leadership part, but around the idea of the student model and mentorship. Thank you, Moni. I just quickly checked in the chat. So one thing this really led to is kind of also exploring what were some of the concepts. And we did see competencies quite common that did underpin. So again, we really want to recognize there was a gap, but there was some things there. And so the idea of the medical, those of you who are physicians know this when you see the leader part of the competencies, and those many of you here were instrumental, but also were very much a part of the interprofessional competency framework. That's a Canadian one you can kind of see in the second bubble. And so the Canadian interprofessional model, the competencies, actually calls out collaborative leadership, where many of the other competency models don't. So, and those of you from practice, again, I'm like, I bridge sometimes the gap working as a physiotherapist, and a lot of my work is with professional development in organizational teams. Leads is a very common one we see amongst administrator leaders, but you can see the differences, that we see distinct differences across professions. We see distinct differences across university and workplace. We see lots of different terminologies, and it can be very broad. So to kind of scope this out as we get to our research question, we decided to use this specific scope of what we define as what we call SLEs, and that's what was in the title, student-led experiences. This is the definition that we use in our Canadian and Australian centers. The idea is focusing on workplace-based learning. We know in IPE and interprofessional education, there's a lot of focus on what can we do in terms of expanding our opportunities in practice and the workplace. So this was really important to us as well, because we saw these models really take shape, especially that we're filling a service and gap in unique workplace opportunities. We also, it was important that we saw ones that were part of curricular placements gaps. So they were really important that they were in the actual curriculum, and they were actually integrated in placements. So that was from our reflexive perspective as faculty. I thought that was really important that we would kind of capture ones that were actually integrated. And then finally, we wanted to make sure that we focused on ones that were addressing an identified gap in the workplace, that they were actually providing something that had a meaningful gap. And so as we get to our first course, this is our research question, and we're going to get into our methodology. Our question was, how is health professional student leadership conceptualized and developed in practice-based student-led experiences? So you can see our focus on, again, practice and student-led. And so I'm not going to spend a great deal of time on methodology, but for those of you who want to look forward, the link is in the chat, and the QR code, again, I provided. And those of you who might have came late, I'm just going to post that one more time. So if you do want to look deeply into methodology, please do. But maybe what I will do is recognize that, I think as scoping reviews as a model, there were ones that there were well-established guidelines from Arxley and Levac. There were also critiques of past scoping reviews around the fact that sometimes it was more about reporting and the scoping of the literature wasn't providing the next step around what would we do, what would be meaningful about this. We also know that scoping reviews was not to appraise the quality of literature, but rather to create an overview or map of what's available knowledge out there. One of the things we thought that was really important is we really wanted to look at the available evidence underpinning the leadership concept. But as faculty and SLE knowledge users, we ultimately want to provide value. So that's what today is about too, where we not just describe the field, but we move the practice forward. One of the things we also want to recognize is having an academic library like Julia as a team member, really having a really strong and equitable voice on our team. This helped the rigor of our search, and throughout the process, having a neutral, Julia has nothing to do with student leadership, IPE, SLEs. She was able to check us on our terminology, our jargon, hold us to methodology, and also support us adhering to these scope and review best practices. So we did, with her guidance, she had led a lot of the identifying relevant studies part of it. We looked through many search engines, and really the idea too was also we did look at reference lists and forward citations. We looked at grey literature, but we did recognize at some point our rigor was really around some of the key the peer review portion of it. And so given the we were trying to be inclusive of trying to make sure that we captured formal required health professional practice-based curriculum. This was really in alignment. As I mentioned, we're faculty, we deal in IP curriculum. We wanted to see things that were tied to curriculum. Now we know we did have to omit some knowledge on purely volunteer student-led experiences. We know this is one of the limitations, but we wanted to also see assessment and evaluation. We want to see integration and curriculum. So we knew those weren't present in some of the volunteer SLEs, though we recognize they do wonderful work. And we actually did read. We had a side list. We read through a lot of the volunteer ones that were just not tied to curriculum or extracurricular. Considering our authorship team's perspective, we also were really interested in experiential learning. Thus why you will see the workplace. I will also say that if we were in doubt, we integrated it into our study because some of them just didn't report some of the information. So when in doubt, we included it. We pilot tested our screening tool. We did have a big review team, and we had, again, an international review team. So we paired ourselves to be Canadian, Australian. We paired ourselves so we didn't have one perspective. And when the pair couldn't agree, we had a third reviewer that was not part of that pair to resolve the conflict. We had multiple iterative and reflexive meetings to define and refine our scoping review screening tool. But again, we are at the mercy of what was reported in the literature. We did notice that some of the report was very telling in what was found, but some of the report was very telling about what was missing. When in doubt, we did include. So we went from 4,659 and to my co-authors, a little bit of just like trauma from looking at that big number. It was a lot to review. It's a lot of work. But in the end, I think what we realized is we actually, as we got screened through, that there was a concentrated amount that were really focused, about 75 articles after full text, and recognizing that really there was an opportunity as well to continue to build on this. I will also say we'll talk more about the English piece, but coming from Amy, we did recognize Amy was in Europe. It's in Barcelona, but it really represented places like the Global South and South America, which in our limitations, we do recognize we are missing out in some of our that English language, and that's part of the reason we're here at the Global Café. Now I'll pause there. Any comments, questions about methodology, about what we've done so far, and then I'm going to come back and I'm going to pass it on to Jodey. We just have given you a lot of information.
I don't
And we
see
know,
anything in the chat. I don't see any hands up for now.
okay, thanks, Kateryna. And the methodology thing can be quite dry, but do look at our scoping review. The link is there. The methodology is well described, and the journal was very good in kind of probing us. Our reviewers were excellent, by the way, in really making sure that we were reporting our whole process, and we were very happy to do that. Okay, over to Jodey.
Thanks, Dean. Yes, it was a big process. It was, I think, several years in the making, actually getting to this point of submitting our scoping review. And as Dean said, there was a lot of decisions along the way about what to include, because there's a huge field of literature, really, when we're looking at the range of terms that we're all thinking about when we think about student-led experiences or placements. But to move to an overview of our findings, and so from those 75 papers, the charting of the data really led us to four main themes, and those were related to how leadership was represented in the theories and concepts that were conveyed about the student-led experience, because obviously that was our main area of interest. How explicit the leadership was within those experiences. Things like how supervision and facilitation happened within the experiences in order to foster leadership, and also then how leadership was assessed, because as Dean mentioned, we wanted to, our aim was to include papers only that had discussed or studied SLEs that were part of curriculum, but it was often quite difficult to ascertain from the papers whether that was the case. So if we were in doubt, we included the papers, and then we really looked closely as to how much each of those concepts were there. Next slide, please, Dean. So firstly, just to look at the types of student-led experiences that were represented across those 75 papers that formed the data. Dean sort of preceded this earlier on in the introduction, but some of this wasn't a surprise, because the key categories and labels, although there was lots of variety in those terms used, much as people in the chat have used different terms today, there were a lot of terms that we're familiar with. So the operational model was often a clinic or a ward or a service of some type. It was sometimes uniprofessional and sometimes interprofessional. There were free clinics, there were community-based clinics, all of those different sorts of operational models. And then from a structural or operational perspective, what was interesting was that the leadership needed in each of those models was often quite different. The leadership required of students or expected of students was quite different across those different types. So it was clear that the leadership that was expected, or the leadership that was trying to be developed to manage a clinic in an operational way, is really quite different to being on an interprofessional hospital ward, and the type of leadership qualities and skills required in that setting. And that is also different to something like leading a community service project, where students are doing more servant leadership. So just to acknowledge the fact that there was a real range in the literature that really echoes the types of experiences that people are putting forward in our chat today. Next slide, thanks, Dean. So then thinking about how leadership was present or identified or labelled in the papers that formed our data, again, that varied quite significantly. On the slide there, you can see some of the concepts that show how leadership was framed, or what was focused on in terms of some of those leadership concepts. So everything from leadership related to content knowledge, to leadership around clinical management of a service, to servant leadership, to the concept of cultural competence being a leadership ability. So it was really variable, those concepts that were discussed and that were included and were seen as representing leadership. mostly reference to leadership theory or concepts in the objectives of the student-led experiences was really hard to find. It wasn't explicit and it often wasn't prioritized. So even in papers that talked quite clearly about student-led experiences, student-led clinics and so forth, it was interesting that often the objectives of the experience didn't prioritize development of student leadership, and it tended to be implicit rather than explicit in the way that the experience was framed and how it was discussed. In rare cases, it was identified, leadership was clearly identified in some of the papers, and in those cases, there was some alignment between the leadership philosophy, the way the experience was implemented, and the way it was assessed. But again, that was much rarer. That doesn't mean it wasn't present, but it meant that it wasn't overtly or explicitly discussed or called out in the papers. Thanks, Dean. Next slide. Okay, so the next finding was really around the supervision of students. And what was interesting here is that the descriptions of supervision were really quite minimal across those papers. Often they were, when supervision was discussed, it was often brief, but it was also often what we would consider standard practice supervision in any kind of placement or any kind of student clinical experience. But there was also in a number of papers a common theme that by leaving students alone and leaving them to be autonomous or being very hands-off was kind of all it might take to foster that student leadership. And that was really interesting because there was a smaller group of papers that really showed us, and as we reflected on it when we looked at the data, that showed us that student-led experiences really can be supported by a more nuanced and responsive type of supervision that really facilitates autonomy and that is customized at a tailored rate across the experience through that provision of leadership opportunities in a very intentional way and through coaching. So again, there are a small number of examples in the papers that actually discuss that, but often not in an in-depth way. So there were some papers, a small number of papers out of the 75 that talked about students being encouraged to go beyond their comfort zone with that guidance and with that sort of safety net, with the support of placement educators being available and students sort of gradually working out when they needed to tap in to that supervision and taking more and more responsibility for that. So that was that finely graded, scaffolded supervision that was there in some of the experiences, but again, wasn't necessarily overtly described. And we thought that was important because, you know, that may be one of the keys to fostering leadership and intentionally developing leadership, if that's what we say we're wanting to do. Next slide, thanks, Dean. And then the fourth area from our findings was around assessment and evaluation of those leadership skills and abilities and competencies. And overall, it was pretty clear that even though we sought to only include papers where student-led experiences were part of the curriculum, it was clear that the way that the experience was assessed often did not focus overtly or explicitly on the assessment of leadership skills over and above general competency, clinical competency, practice competency. So development of leadership was not often not explicitly integrated into the curricula or measured in a way that other learning is measured. Again, a very small number of papers did do that, but it certainly wasn't a feature that was described in depth or in a way that could be repeated in other studies or in other practice. Next slide, thanks, Dean. So moving on just to a few points to kind of think about what points of discussion might arise from those findings. You might need to click through the animation there, Dean, I think. So first of all, just to really acknowledge that clearly from our data from these papers we included, there was clearly a range of really excellent initiatives and really inspiring initiatives in many cases that were happening with student-led experience. And obviously, as probably most of us know, that tended to increase post-COVID, where there was a lot of service gaps and there was the need for all hands on deck, and a lot of really thinking laterally about how to address those service gaps. And that's where student-led experiences were the vehicle for serving some of those gaps in services. So outreach, education, underserved communities, those kinds of things. So in those situations, SLEs were used to highlight a need really and to pilot a solution. So that was really excellent to find that in the literature. Next slide. Thanks, Dean. And secondly, I guess another bit of food for thought here is that the literature showed us that there were models where service was prioritised, but maybe learning less so. There were other models where learning was prioritised, but with less direct link to filling a service gap. And our reflection on that is that maybe we can think in terms of more of a triad model that is designed and implemented and assessed to prioritise service and learning and leadership in a more intentional way. And next slide, thanks, Dean. And just one more thought there from the discussion is that in our paper, if you have a look at the paper, we in our discussion were able to distill a number of 5 different leadership profiles that were the focus of the student-led experiences to various extents in different papers. So things like students as manager, students as servant leader, or facilitator, students as educator, a peer educator with other students, were all present there. But the reflection on that is really focusing on the idea that there really were opportunities here to respond to our contemporary health system challenges by really aiming for students to develop more as collaborative leaders and as transformative leaders, which would be nice to aim for going forward with the literature and practice in this area. So that's me, I think, for now. I can hand over to you, Kathryn.
Absolutely, thank you. And I'm just wondering, Dean, could we forward, or just looking at the time, can we forward a couple of slides? Because there's been a lot of information provided. Again, one more. There we go. So there's been a lot of information that's been summarized in terms of what we found. And as you've been listening, our real curiosity is for you. Now, there's been some wonderful comments in the chat, and our curiosity is what's next. So when we think about, and as the team has mentioned, that there's been presentations locally, nationally, internationally, there's papers that are out there. We have been talking about this work, and we have been hearing some thoughts or hopes around what it would be next in this work. So our curiosity is for you, and maybe if we could post these questions in the chat as we maybe come off sharing, what is it that is inspiring or resonating for you about what you've heard? So thinking about your own context, student-led experiences in your own orbit, and what we've talked about today, what is it that's inspiring or resonating for you based on what you've heard?
Thank you so much, Kathryn and team, for that lovely presentation. As Kathryn has welcomed, for all of you to put your comments in the chat or raise your hand, and I'm happy to call upon you to get our mini discussion started. And Dean, thank you so much for popping the questions in the chat. So they're there for you as well.
Thank you, Dean. What is the invitation for this work?
Okay, so we have a comment in the chat. Dean, we have a formal IP curriculum, and the student-led wellness center we developed is where collaborative practice takes place for students from Gerard. Thank you for sharing that. That's phenomenal.
And Gerard, sorry, if you're comfortable, just have a follow-up question. In your experience, how is leadership defined? What leadership capabilities are honed in these students in your context?
Gerard, please, I see you unmuted. It might be easier than typing. Go ahead.
Hi, Kathryn. Are you able to hear me?
Yes.
Wonderful, loud and clear. Thank you.
Okay. I think it's a great question. And I think I've asked the question in our faculty, sort of, where's leadership taught? We don't have a module where it's called like a leadership model or module. But I do think the wellness center that we established creates the opportunity for students to actually practice their leadership. So there are aspects in our wellness center where students take responsibility for the booking of clients, for meeting with other students and discussing patients, for looking at opportunities for collaboration and for research and things like that. So I think just to some extent, we have interprofessional supervisors that actually go out and facilitate this discussion with students, but to kind of guide them in terms of adopting a certain leadership skill or leadership role among the students. So there's facilitation of the leadership skills, but creating opportunities for them to actually operate in a wellness center and to take responsibility and for the operations of the center. So in South Africa at the moment, that's how we are doing it. But we realize, leadership is not, it's not something that happens automatically. You have to engage students, you have to teach them certain skills, which we don't have at the moment. But we're doing it in practice. And the plan is that we develop a module where we can actually engage students and give them the skills, etc.
Yeah. Love that. Thank you very much.
I wonder if I could just add a small comment there, Jared. I'm wondering too, like when we think about leadership skills, because that's often a term we use, as we're sort of looking at the types of experiences that we saw in our scoping review and we experience in the work we do. If it's also about more than skills, if it's about identity and self-concept and how the students are viewing their own role in the not just the operational management of services, but in the decision making or in the way that services and move forward. Just a thought.
Thank you so much, Jodey, for that additional response. The chat has been hot, and I really love being part of this interprofessional global community because of how engaging it always is. To Dean's point, we have two somewhat related comments next from Brian and Anthony. With Brian stating, I'm struggling to reconcile student-led with the need for the activity to be part of the curriculum. If it is part of the curriculum, doesn't that mean the school/program has to ensure it happens? I think of student-led as an activity that will go away if the students stopped leading it. And then Anthony mentioned the balance between autonomous leadership and accreditation supervision requirements, same profession or interprofessional supervision. So I'll turn it over to your team to comment on these two. Dean, please go ahead.
Okay, sounds good. I think we're all unmuting, so we're eager to jump. This was a tension, right? Like this was at the very beginning of our study, and interestingly, at University of Toronto, one of our most valuable SLEs, and I say valuable, is our Imagine Clinic, which is not integrated in the curriculum. It is a volunteer. And I think it can be both and. I think there are opportunities where students, especially there are many students who volunteerism, and this is where we actually saw the opportunity for some of the principles in servant leadership that built on the community could be really beneficial. But one of the things we did want to recognize is to develop the competencies and actually to make sure that it's longitudinal, it's integrated in the curriculum, which is always hard because sometimes IPE is an add-on, leadership is an add-on. We kind of see that is just trying to trying to see if they were integrating, what is it? But I think your point was well taken, is we don't want to lose that either. And also we don't want to take it over. That was the other thing that was interesting. It wasn't just, in fact, I think in most cases, it was almost a hands-off approach. It was like, let the students do whatever they want to do. But we're suggesting a medium. But on the other hand, it can be, we saw some that were really faculty-led, and they were just called student-led. So that's a really important concept. And I see, Brian, you're nodding there. And Anthony, I'm going to tackle it, but then I'm going to pass it over to my colleagues. The accreditation was really interesting. And I think the autonomous leadership, I'm just going to comment on some of the accreditation I know from physio, IPE, in our own circles, is sometimes it's very broad that suggests a leadership component, and they don't define like what type of leadership, what it is. So I think that's the tricky part, even in IPE and accreditation, is it's a checkbox once you've actually done this. And I do think that might be the pressure why some of the SLEs we saw were name only. It was to respond to an accreditation need, but that's just my own 2 cents. Jodey, I know you're muted, and Kath, I know you want to jump in as well.
I guess in terms of just thinking about the concept of, is it student-led if faculty are leading it? I guess one sort of thought there is that we might be looking at a bit of a sliding scale where there might be some opportunities and experiences that students can be the absolute instigators of, that really comes from them and is really around opportunities they've identified. But I don't know, I feel that probably it is worthwhile if you think about the concept of leadership and how all leaders are formed over time. There is an aspect of mentorship, of wisdom from others who have gone before, of structures and guidance and facilitation around you. So I wonder whether we can think about it as not always needing to be on this end of it has to always be student instigated, but that from the faculty perspective, like we do with other student competencies and student development, we're providing the structure and the framework for the opportunities to learn leadership and to experience leadership. And so we're facilitating through providing those structure and opportunities.
And maybe I'll just add to that. I love Kelly's comment in the chat because I think it speaks to faculty development. I think there's an invitation here for faculty development for supervisors within a student leadership experience. So, and it all comes back to how we're defining leadership. If we're defining leadership as leaderful practice, so students are learning to come into and work in solidarity with people who are living with a care gap, they're not coming in with the answer. They're coming in with questions, and they're coming in with deep listening skills.
Mm-hmm.
Have a supervisor come in and give them the answer is not necessarily modeling the type of leader we are looking to nurture. So there is a huge faculty development opportunity here.
Mm.
Our experiences, and I'm very curious what experiences are around the globe, are around how do you support your faculty and your supervisors to support. Moni used the word mentorship earlier. Mentor, coach. Is it the guide by the side and not the sage on the stage? Like how do faculty bring their talents, their abilities, their superpowers in ways that facilitate student leadership development in ways that are needed? And so how we define what is the leader that is needed And how do we model that? So really excited about Kelly's comment in the chat.
How do we model it and how do we facilitate it? Because you're right, Kathryn, it's very nuanced. It's actually very skilled to do that well. We can't underestimate our supervisors and educators in those practice education experiences, what is actually needed to really facilitate, because that's what they're doing. They're making decisions on a moment by moment basis about what information to give, what information to hold back, what questions to ask, what to reinforce, and really, celebrate with the student in terms of their developing leadership. It's so nuanced.
Yeah.
Thank you so much.
Sorry,
Thank you so much. Yeah.
I just have a quick.
Oh, sorry, Kathryn.
Go ahead.
I'm just looking at the time, and I know we have about 7 minutes remaining, and I'm a stickler for time. And I wanted to thank all of you for attending. There are some lovely comments in the chat from other attendees that I would encourage you to look at. And there are also links from Brian, for example, and some other resources that have been included in the chat that I would welcome for you to look at. But at this point, since we have a couple minutes, I do want to open it up if there's a question or two or a burning question or two for our presenters. Sorry, I'm losing my voice. For our presenters. And again, I'm monitoring the chat, or if you want to put up your hand, but 6 minutes, no pressure. Does anyone want to ask a burning question to close us off this morning, afternoon, or evening? I do want to give the team also a final minute to wrap up this dialogue as well. Thank you, Dean, for including the questions as well. Gerard, please go ahead.
Yeah, I just want to say thank you for the presentation, and I look forward to reading the publication. I just wanted to ask the team, now that you've done the review, what are the next steps? What are your plans? I'm just really interested. Thank you.
Thank you for that question. I'll turn it over to the team.
So maybe I'll just jump in first, and then I'll let Jodey and Dean also provide their comments. And I'll just speak for me. We haven't had this conversation as a team before. My hope is that we come together as an international community and talk about the kind of leadership that is needed in the next generation of health professionals, and that we co-create together a position statement. We bring together the results of the scoping review. We bring together our lived experience, the amazing work that has been done in languages other than English. We bring all of our collective knowledge together and compose a position paper around the type that is leadership that is needed moving forward, and how the role that education might play in that hope. So I'm just putting that out there, but I'll let Jodey and Dean.
Well, I'm going to jump in too, because Kath, we actually had a similar conversation. You had to leave at the end of one of the meetings, and Teresa, Jodey, I know you were all there at the end. We were kind of like same thing, like what is our next step? To create momentum, and I think we're thinking about opportunities like conferences to do a knowledge forum, or an opportunity to do a joint grant, joint publication, like try to reach out into the areas we know we missed, especially, the scoping review, we had to scope it. It had to be English language. We knew we were missing out. So I'm going to check in also, and Teresa, I want to give you a chance to jump in too. I'm sure do you have anything to add to that? I do remember some of our conversation.
No, nothing really to add, just to reiterate that invitation that Kathryn put out about trying to gather people's thoughts together across the world and move this idea forward of how to facilitate leadership within student clinics. So I'm just excited to see what happens ahead.
And I would agree with that wholeheartedly. I think in our findings, there were so many amazing leadership opportunities for students, and within the Global Cafe, being able to reach out and discover more to highlight them. Again, very simply, I think for anyone working with students, it goes back to just explicitly, being explicit about teaching, supporting students in reflecting on their leadership capabilities, and the learning that's happening, across the world in clinics as we speak, that doesn't have to be further developed, just recognized.
And I think to follow on from that, Teresa, like that's actually where we started when we came together as a group, is that we were thinking about how do we develop some kind of consensus on this? And then we thought, well, we better actually do a deep dive into the literature of what's there already before we sort of go down that track. But we've sort of we've circled back around there now that we've done that deep dive. And I think like many other aspects of practice and education, I'd like to see us work towards what is best practice in this area, what is best evidence-based practice in this area, because student-led experiences are growing like topsy all over the world in all different directions. So having some kind of agreement about what leadership is, what it looks like, and how we develop it, and developing the skills to do that has got to be a good direction to go in.
Thank you so
And I
much,
know
Gerard.
Kateryna, can I add one other thing?
One
I
small
love the
thing, 30
connections
seconds.
for
We love
African
talking about
Society of Student Run. Yeah, let's keep bringing this to. Please do take this to other places, but leave your email if you want us to connect with you to continue the conversation. There might be a very specific opportunity.
Thank you so much. And Gerard, that was a beautiful way to close off our session today. There are some closing remarks in the chat, but I'll just reiterate from Allison that our next IP.G Café is on October 22nd. If you've enjoyed today just as much as I have, and I know I'm biased as the moderator, you do want to join if you haven't yet. The link that Allison has provided to stay up to date about the latest news and how you can join future global cafes or perhaps lead one of them in the future with us. And there is a comment also from Anthony that this recording will be on the YouTube page over the next few weeks for you to interact with further and follow up with the presenters as well in terms of Dean's request for you to share your email addresses. It is 8 o'clock Toronto time, so